for those who participated in this, and thank you to those in Northern Health who are on the line waiting to come on for the presentation today. And I would invite others who are here. I think the Northern Health presentation is an important one for our community. So I will call the meeting of our regular council meeting to order. I do recognize we meet on the traditional territory of the LHTAKO DENE Nation, and I do want to speak tonight about our thoughts and heartfelt thoughts going out to the people of Ukraine. I know that they are top of mind for most Canadians these days. With that in mind, the approval of the agenda, there is no changes to the agenda, so if I can have, is there? The presentation,
yeah.
In color, yes. Yeah, but the substance of the agenda is the same. So can I have a motion to approve the agenda? Councillor Runge, Councillor Rudenberg, second. All in favor? Any opposed? Carried. And adoption of the regular minutes of February 15th. Councillor Goulet, Councillor Vic, all those in favor? Any opposed? Carried. All right, Daryl, if we can see your big bald head, then we'll have two big bald heads on the screen here. Thank you for joining us, Daryl, and I'll let you introduce your team. And as I indicated, this is a very important presentation for council and for the community. So for all of your team, we don't live stream council, but it will be broadcast tomorrow and available on the city's website. For council's edification, this presentation tonight comes out of a meeting that Director Turner and myself had as we continue to look for ways to support our community in the domain of mental health and addictions. And we've done some very strong and important work with Northern Health over the years and with BC Housing. But I think a lot of that's come together recently, and we thought it was important for council to get a sense of the breadth and the depth of the programs that are now being made available in our community. So with that, Daryl, I'll turn it over to you to lead the way.
Thank you, Mayor Simpson, and thank you, Council, for this invitation. We thought this would be a good opportunity to update Council on circumstances as they relate to the provincial opioid emergency, focusing on provincial, Northern Health, and local Quesnel statistics, along with some local initiatives we have undertaken to improve service delivery for those we serve. For those of you that don't know me, I'd like to introduce myself. My name is Daryl Petzel. I'm the Health Services Administrator here in Quesnel with Northern Health. Within that role, I have operational responsibility for anything Northern Health related in our community. And I'd also like to introduce some of my colleagues, starting with Shane DeMeyer. Shane, you can introduce yourself.
Thank you, Daryl. My name is Shane DeMeyer. I'm the Director of Specialized Services for the Northern Interior. So that is basically Prince George, Quesnel, out to Burns Lake, the Robson Valley. What I was hoping to do, if people can bear with me, was just sort of give a really brief overview of what specialized services is, because I do think it's pertinent to the discussion in general about how we're trying to bring services, the appropriate services for Quesnel. So basically, there are 4 different areas of specialized services that we've been looking at. The first one would be specialized counseling and high intensity. Again, Quesnel's already had an awful lot of this where it's been developed so that it actually meets the community need. So this would be the nurse working with RCMP. But what we're also doing now is expanding what we call the ACT team, which again is it's an assertive outreach team. Is to actually work in the community as opposed to, having people come to the hospital or into offices, that kind of approach. Overdose prevention is also part of the specialized counseling and high intensity, as is the FNHA, so First Nations Health Authority. The mobile support team is also part of that plan. We also have the Child and Youth Regional Specialized Services. So this is what we're starting to look at for Quesnel. And I think Sheila is going to speak a little bit about one position that would be starting. But this is where we start looking at the mental health as well as the addictions needs in the community. Although we don't provide community mental health, that would be MCFD. What we do provide is the in-hospital, so the acute setting. And this is about how do we actually address things before they need to be in an acute setting. The next is, again, acute specialized services, so that's the hospital. So that would be the Quest unit, and looking at planning so that we can actually move the Quest unit to a higher level. And each, in the Mental Health Act, there's different levels of designation for hospitals. And all credit to Daryl, because he's been working on this for years. But looking at Quesnel actually being a fully designated hospital. So that's in the works. And then the final is mental health tertiary services. So for us, tertiary services are residential, but they're also things like rehabilitation. And again, Quesnel's actually already had a superlative program, the Grace Young program. This is about how do we support it, grow it, and have it develop so that it actually meets the local community needs. So that is my role. I'm based in Prince George, but it's to help support the work that Daryl has already been doing. So, thank you, everybody.
Thank you, Shane. And we have Dr. Raquel Kling with us as well.
Hi, I'm Dr. Raquel Kling. I'm the Medical Health Officer for the North Interior, so the same region that Shane covers, that he mentions, which means I'm the public health physician supporting not just public health needs of Northern Health. I also support the public health needs of the community as well and directly respond to community needs. So yeah, I'm just here to support and answer any questions that Daryl, Shane, and Sheila can't answer. And I'll introduce Dr. Diana Bark, who's a medical resident working with me.
Thank you, Dr. Kling, and also welcome Dr. Bark. And Sheila Anderson.
Hi there, my name is Sheila Anderson. I am the manager for specialized services here in Quesnel. So I directly report to Shane DeMeyer, the Director of Specialized Services, and cover the portfolios in Quesnel that he mentioned. And we have a matrix relationship out to Daryl. So we work collaboratively, but we have the ability to draw on Prince George's resources with that connection with Prince George.
Thank you, Sheila. So what I'm going to do now is I'm going to go through a few fairly high-level slides that will talk just a little bit about the provincial emergency, a little bit about the history, and get into a few statistics provincially and locally, talk about some initiatives that we're working on, and then I'll hand it back over to Sheila, who will get into some more detail about the work that's the really exciting work that is affecting Quesnel at the moment and in the time to come. Okay, so we'll get on to slide 2. So you can see back in 2016, so this provincial emergency due to opioid-related overdose deaths has been going on for almost 6 years. Several $100 million allocated to spearhead life-saving initiatives, which we'll talk about many of those as we go through this presentation. And we have an overdose emergency response center that is working provincially, regionally, and locally, which is helping us mobilize resources within communities. Next slide. Here's some data on illicit drug toxicity deaths in Northern Health from the last 6 years. So you can see what Northern Health's death rate of 48 per 100,000 citizens, which is the third highest in the province between health authorities. And we break it down a little bit further here between the Northwest, Northern Interior, and Northeast. health service delivery areas. So that's a geographical sub-region within Northern Health. And just so everyone's aware, Northern Health extends roughly, give or take, from Macleese Lake-ish north to the Yukon border, from Haida Gwaii east to the Alberta border. So it's a huge geographical area. It's roughly the size of the country of France. So we're dealing with a major geographical area, and that in itself presents a lot of challenges. This slide shows the darker the color, you can see this is the province of BC. Northern Health would start at that faint line right underneath the NI there in the middle of the province, and it would extend to the northern border of BC. The darker the color, the higher the rate of overdose deaths per 100,000 population. So you can see that Northern Health and certainly Interior Health as well, right down the middle of the province, is experiencing a fairly significant number of deaths. We did have a decline in the Northern Interior. So Northern Interior is from approximately Burns Lake east to the Robson Valley, from Mackenzie south to Quesnel. So it's the most populous area in Northern Health. And we did see a decline in number of illicit drug deaths, overdose deaths for 2021 compared to 2020. Dr. Kling may be able to speak a little more clearly to this, but we have talked about it, and we think that this may be due to all the initiatives that have been rolled out in our area over the past couple of years. There's a lot of work going on the streets to prevent death and get people hooked up to services. The Northern Interior, so again, this is the area I talked about. We're still in the top 5 health service delivery areas in the province for rate of drug toxicity deaths. So there's 6 DENE health service delivery areas in the province, and they are geographical areas distributed amongst the health authorities, and the way it works is you start at a community level and you aggregate up to a local health area, and then an HSDA, and then a health authority. So it's a bit of a stepwise progression. Okay, so the latest statistics we have available at time of the slide presentation were from November, December. So 2021, just a few months ago, 210 and 215 deaths respectively, and that equates to about 7 deaths per day. And this is a provincial number, by the way. This isn't Northern Health related. And you can see at the bottom there, December and November 21, Northern Health had the highest rate of illicit drug toxicity deaths in the province. So Quesnel, getting down to the community level, 27th in BC in terms of communities. Our rate's about 45 per 100,000 individuals. We saw 11 deaths last year. 54% reduction in suspected opioid overdoses being reported by our emergency department to public health over about a year. Now, that number doesn't mean too much. It sounds like a good thing, but we're also doing a lot of work on the streets to prevent emergency presentations. And there's also people that have a lot of overdoses in general do not, or the people that are entrenched in the streets generally do not seek traditional healthcare services. So we don't see a lot of them in the ER. So that we don't really know what's happening out there. Emergency health services, so BC Ambulance, their events that they attended in early 2021 were higher than average, but have since returned to average. So responses are components of an overdose response. So this is a really high umbrella, overarching strategy that we're focusing on. So we get into some examples here. So addictions, treatments, and supports, hospital and emergency, visits, treatment beds, professional education and training. There's an awful lot of training and education involved with nurses, physicians, et cetera, everyone in the healthcare system. Going through school, you don't get a lot of education in this, and so it's ongoing. We're having to catch ourselves up to the latest research and maintain our competency and be current. Data analysis, so that's where people like Dr. Kling come into play with a strong background in epidemiology. We're really getting down into granular levels of data, identifying trends and regions that need attention. Opioid agonist therapy, so you'll see the acronym OAT, O-A-T, come up in further slides. So in a nutshell, that's therapies like methadone programs and Suboxone that we can talk a little bit more in a bit. Youth substance use services. So we've recently been granted some funding to get a position to focus solely on youth. I've always said that it's very important. It doesn't matter what the health issue or the social issue is. It's very important that we start in infancy or with families, with young kids, and do that upstream work, or we're always going to be knee-jerking. And we working with our local Indigenous populations and partnerships, key piece of our strategy, stakeholder engagement with the city, with RCMP, with the school district, with other agencies, and of course, distribution of harm reduction supplies and overdose prevention services and supervised consumption. We'll talk a little bit more about that. Priorities currently. So we're planning to expand overdose prevention services, in-reach overdose prevention services and intervention. So in-reach, and I just learned this week, thank you, Sheila. In-reach is the new word for outreach. So I used to say we would be out on the streets in the community doing outreach. The newer term is in-reach, to reach into particularly hard to reach populations. So that's what that means. Expansion of our OAT, or opioid agonist therapy services. We currently have roughly 170 patients in that program, Sheila. Okay. And that's, we do most of that work over at Westside Mental Health and Addictions. Prescription alternative programs, virtual resources, especially with COVID. We've transitioned to a lot of virtual medicine, and it's a key tool in providing services. And there's a real big future in virtual medicine. And we're also getting into RN and RPN prescribing of some of that OAT treatment. Currently, harm reduction services that are available in Northern Health, and that would include Quesnel. So harm reduction supplies, safer injection supplies, safe disposal units, so personal sharps containers, safer inhalation supplies, safer sex supplies. And again, all this stuff it's not just about protecting the individual, it's about protecting the community, because a lot of things we deal with in public health are transmissible diseases and they can spread throughout populations. And so this is about protecting the community. Overdose prevention, take home naloxone kits. So that's your Narcan kits that can reverse an opioid overdose. Overdose prevention sites, safe supply programs, and prescription alternatives. So key takeaways from my brief overview. So this is an unprecedented situation. So not only are we dealing with the opioid crisis, but we of course have the pandemic going on amongst many other stresses and challenges in the world. Difficult to address two health emergencies simultaneously, and certainly the pandemic has compounded the problems of the opioid emergency. So one of the things that's happened with the pandemic is due to difficulties with travel and crossing borders, street drug supplies have become very, very toxic and unpredictable, and it's led to a lot of tragedy and death in our province. Overdose deaths are still as high as they've ever been. And so as a response to the increase in overdose deaths, funding is coming at us, and Sheila can talk a little bit more about this with the details from the Ministry of Mental Health and Addictions to deal with this. And again, we're focusing on, the OAT programs, increasing access to overdose prevention services, which increases the interface with the people we serve and care providers. So again, traditionally, that population rarely sought traditional services. And so this is really creating an interface so we can, help people out. And I think that's about it for me, Sheila. So if you want to get into your part, I'll hand it over to you.
Sounds good. Absolutely. So, and like Daryl said, a lot of the population that we're serving through specialized services in Quesnel, they won't seek traditional healthcare services. They don't want to access via hospital, et cetera. So a lot of our services have focused on in-reach, or what was traditionally referred to as outreach. So reaching into the community, making contact with folks where they're at. So if that means going to their homes, going out in the community, if they're not housed or precariously housed, we're still going out and doing that outreach service. So we've focused a lot of our development of our programs in the last year on outreach services and really connecting with folks on the ground. Instead of expecting people to come into our clinic here or into the hospital to access service, and it's been relatively successful in our population. There's been a pretty rapid implementation of services in Quesnel. We've worked quite hard, and we've secured numerous new positions and established a couple of new teams. So I will go over sort of a high-level overview of what that looks like and what the staffing on the ground looks like for you guys. One of the key components to our strategy in Quesnel is overdose prevention services and really expanding people's access to overdose prevention services. So we've been able to secure a registered nurse, a community life skills worker, and a social worker. And we staff them Monday to Friday currently from 11 o'clock to 7 o'clock. Primarily at this time, this team is focused on doing that in-reach work, connecting with people at a community level, establishing a rapport and relationship, ensuring that they're building trust with the folks they're serving. Some of the work they're doing is ensuring and monitoring for overdose, so reversing overdoses if they're encountering that in their work, but also connecting people back to service and really just establishing good relationship with healthcare providers. We've been able to mobilize a lot of our traditional primary care services, so stuff like prenatal care, going out and checking on moms and babies, working with connections to OAT, helping people get to appointments, getting them to their primary care providers or their family physicians, doing blood draws for people who might require it. And we've managed to make most of these services mobile so that we're reaching this population where they're at. Our opioid agonist therapy program, our OAT clinic, is providing some medical and social interventions here at the Westside Clinic, but we've also mobilized some of those services. So they're doing outreach on a weekly basis to connect with the population that is best served by the OAT program. We have a registered nurse, a mental health clinician, and as Daryl mentioned, we're also adding a youth substance use clinician position that will primarily focus on doing that in-reach work in schools, in the community, the youth center, et cetera, building those partnerships, building partnerships with MCFD, and making sure that we're getting good service to our youth in the community as well, because there is a substantial need. It's something that makes a lot of us very uncomfortable when we see the amount of youth that we've had using substances. So we want to, of course, ensure that they have good access to healthcare services. They are running the clinic here for 4 days a week. The staff are here 5 days a week, but we have clinics with Dr. Engelbrecht 4 days a week, which is a substantial increase from last year. We previously, so our 2021 stats, the beginning of 2021, we had 100 patients on our OAK program here in Quesnel accessing these interventions, and now we actually have 170 patients. So we've expanded service provision rapidly in the community, and there's been a growing need. So it's seen some really great successes, actually, that program. They provide, and of course that's what's highlighted in this. The Assertive Community Treatment Team is new to Quesnel. And they provide some of that assertive intervention, as Daryl was speaking to and Shane mentioned. We have previously had our MCIT team in place, and they still are out there doing outreach on the streets. That's our registered nurse paired with an RCMP officer. They've had some really great successes. But the Assertive Community Treatment Team, they're paired up with some of our most vulnerable patients, and they're providing 7-day-a-week intervention for those patients. They're out of the office 75 to 80, 85% of the time, doing in-reach services with this population. And they are connecting them with healthcare services. They're ensuring that they're adhering to mental health act provisions around care. They're ensuring that they're taking medications. They're making sure that they're connected back to OAK programs, that they're getting primary care services. Sometimes this work involves really basic level care, like treating wounds on the street for people who are maybe experiencing infection because they won't access those traditional healthcare systems. I think that overwhelmingly we've seen better success with these types of services where we are meeting people where they're at and not expecting them to come to us. So I see these services expanding in Quesnel. This team consists of 2 registered nurses and 2 life skills workers. The life skills workers are able to assist people with getting to appointments, assist them with finding housing, connecting to services in the community, connecting to aging services, etc. And the registered nurses provide the good nursing functions that we need to see with substance use and mental health interventions. This team serves our most marginalized and vulnerable in this community, and I think that's really important to note. They serve the folks that really need contact daily and connection daily with healthcare services. We also have our DELEGATION wellness team. This consists of 2 registered nurses and a social worker that travel out to our rural and remote Indigenous communities, including LHTAKO and LHTAKO, and they provide specialized mental health and substance use services. They also provide some primary care functions in that community, or in those communities. One of the highlights of all of our in-reach teams that are doing this good work and meeting people where they're at is that they've actually been really key in our COVID response in our community as well. They've gone and traveled out and done mobile vaccine clinics. They've assisted with COVID testing and PCR testing. They've arranged hotel rooms when folks that were precariously housed needed to self-isolate. And they've been really key in the interventions there and ensuring that we limit the spread of COVID. And as mentioned, we have our mobile crisis intervention team as well. So this is our registered nurse partnered with an RCMP member, and she also partners with other community stakeholders, and they provide in-reach services in the community and connection back to healthcare. She also provides good liaison work between the community and our community partners, our vulnerable populations, and our psychiatry team. And she connects folks when they do end up in acute care. So our Quest unit that Daryl was mentioning earlier and Shane was mentioning, we are working on expanding that unit, and we're seeking designations so that it's not simply a short stay unit and that we have some fairly cohesive programming on that floor to meet the need of the community and to ensure that people don't have to leave community when they need that higher level of care. That's the end of the PowerPoint. If anybody has any questions, of course, we have just highlighting our pre-existing mental health services that we had before the rapid expansion as well. We have a team of mental health clinicians that's attached to our primary care team at the hospital, and they can provide one-to-one services as well as group interventions, et cetera. And that was pre-existing prior to the expansion of specialized services. And then we, of course, have our life skills work. And then, as Daryl and Shane previously mentioned, we have our vocational and recreational rehabilitation programs and our job development programs. So those are already in place, but we are looking at expanding them, and we've made some recent new hires that I'm really excited to connect with or to see them connect in our community with some of our stakeholders and sort of expand that spectrum of services to not just the response to the overdose crisis, but to just respond to mental health and substance use crises in our community in general.
Thank you, Sheila. And so, yeah, happy to answer any questions anyone has at this point.
Great, thank you, Daryl, and I'm going to turn it over to Council. So, Councillor Goulet.
Thank you, and thank you guys very much for the report, Daryl and team. I just have on the overdose response components, you have treatment beds, and I'm just wondering if there's been, I have a couple of questions actually, but one that stuck out for me is the wait time to get into these treatment beds. I think if we can somehow, and I know there's been lots of conversations on how we do that. I think we lose them when they're coming in and they want that service now, and they have to wait on a wait list. They're going back out and getting involved in what they were doing. So I don't know if there's been any discussions on how we can work collaboratively to get those treatment times and those wait times down. The other one, while we're on that too, is the younger generation is attending in emergencies and having overdoses and being in that category. So is there a way to sort of focus on that younger population? I'm thinking of the 19 to 25-year-olds. There's a youth gap there that they end up getting caught and using those drugs, right, and then get further down into it. So, and then I have one more, but those were the two on that one for me anyways. Thanks.
Yeah, so treatment times has been sort of an ongoing concern within the province, and I often hear this feedback from folks that it's a bit of a barrier around treatment times. But when I actually really looked at the data and looked at some of our treatment centers, the issue with treatment centers isn't necessarily that there's a wait time to get a bed, it's that there's some consistent barriers that we're finding to getting folks in place at treatment. So these might be things like folks don't have ID to get on a plane to fly to the treatment center. In recent times with COVID, maybe folks aren't vaccinated, so we actually have to then get them into vaccination and get them ready to go to treatment. And I absolutely agree that those delays and those barriers are an issue, because when people are ready to go to treatment, you have usually a short window of opportunity to get them there. But in terms of bed availability and the actual beds being there, we do have beds available, and we've been able to mobilize folks fairly quickly. Provincially, we now have the Redfish Healing Centre as well in place. So I think that that's some of the good life skills work that can come out of Quesnel, and some of the positions we've added is that when we are in contact with folks in the community, we're able to start mobilizing them to get their IDs in place, to connect with healthcare services, to do those vaccine programs, to get things established so that when they are ready to go to treatment, we're able to mobilize quickly and get them there. And then in terms of the younger generation, I 100% agree, and I think that a large focus of some of our expansion has been on making connections with that younger generation, and again, building rapport and relationship. We've really lucked out with some of our nursing hires as of late, and they have had really quite great success on connecting with that population that sometimes is difficult to connect with. So most of our nursing hires are from community, they're from Quesnel, and so they have pre-existing relationships in the community that have allowed them to build relationship quickly. And we are seeing an influx of individuals in our clinic that want to connect because they know the people that are providing that service.
Great, thank you. Councillor Goulet, you said you had one more?
Yes, and thank you very much, and thanks for that. Just on the virtual resources, and just wondering do you have a number of how many access those virtual resources? Because that's quite important, because we have a vulnerable population that sometimes doesn't have that access to online or able to get onto those resources right away. So I was just curious if we had a number, because that's an interesting, and where we're going with technology and stuff. Just curious.
So in terms of our telehealth resources, primarily our Oak Clinic has been able to do the expansion that we've been able to manage to 170 patients. because we have a provider in Williams Lake who's willing to do telehealth services. So we still facilitate folks coming into the clinic in person. We're still connecting with them face-to-face. They come in or we go and pick them up and bring them to the clinic for their telehealth appointments. And so we've been able to expand from 2 days a week of service to 4 days a week via telehealth. We're also utilizing telehealth in some of our Indigenous communities where it's available, and we're looking at expanding programs out into our Indigenous communities that we previously couldn't have out there because they have telehealth systems established now. So we're able to connect them with our providers here.
Great, thank you. Councillor Paul.
Yes, thank you, Mr. Mayor, and thank you for your presentation. I have 3 questions tonight. One, is there a profile of the victims? And I'm not looking for specifics, but can a certain segment of the general population be identified as where the problems are? And I have 2 other questions.
So you're talking about demographics, Councillor, like age?
Yes, I'm talking like age, gender, maybe ethnicity, whether victims are employed or unemployed, they come from a home or they're homeless. That's what I'm looking for.
Yeah, so that information would be held by the coroner service. We would not hold that information as a health authority. And I'm not sure if Dr. Kling is still on the line. Dr. Kling, did you hear that question about the demographics of the deaths? Yeah.
Yeah, I mean, I can comment a bit generically from like a provincial standpoint. So generally, provincially, what we're seeing now and what we've seen, I think, almost entirely through the overdose emergency is that the majority of those who overdose and die from overdose, they're mostly young males in kind of the like 20s to 40 age category. And most die at home alone, using at home alone, so most are housed. And statistics are a little bit different for the Indigenous population. We do know that the Indigenous population does overrepresent in terms of deaths, and we do tend to see more females in the Indigenous population who do die from overdoses. And I don't have specific numbers in terms of the data, but we do know that this does, even though it does affect, slightly more, working age males, it does affect all areas of the population. It doesn't discriminate and can affect everyone.
Okay, thank you. Thank you for that.
Sorry, Sheila, did you want to jump in?
I just think it's worth adding when we talk about, being aware that it's young working aged males, so young 20 to 40-ish that we've seen in, discrepancy with overdose rates. I think it is worth noting that some of the programs we've rolled out in Quesnel this year have actually been able to assist that population, a lot of folks getting back to work, because we now have access to a medication called Sublocade, which is a depot injection. So it allows people to actually do their depot injection, and then they don't have to return for service for another month. So some guys who previously wouldn't come in or access treatment because they worked on the road or they worked in the construction industry, et cetera, are now able to access good quality treatment through the clinic. And that's something that's relatively new for this year still.
Councillor Paul.
Thank you. And I think I know the answer to this question, but in your presentation, it is noted that there were 11 deaths in Quesnel in 2021. I'm presuming that Quesnel includes the communities around Quesnel. In other words, it's the Quesnel catchment area that would be included in that number?
Yes, so any death in the community would generally come to hospital. That's where our community morgue is, and so it would be the Quesnel area.
Yeah, thank you. So so certainly a community such as Wells would not be excluded. It would be part of that catchment area, right?
That's actually a good question, and to be frank, I don't know if Wells would be differentiated from Quesnel. Dr. Kling, I'm not sure if you know, Wells is a very small community, approximately 80 kilometers east of Quesnel. There's no health services there other than an ambulance station.
Yeah, I agree, Daryl. I'm not sure off the top of my head. I suspect that the Quesnel data is for the Quesnel local health area. So whatever is included in that geography.
Yeah, so, and we provide some health services out in Wells. And so my assumption, and Councillor Paul, if you wanted further information on this, I can find out, but my assumption would be that it would probably be included in the Quesnel data.
Yeah, that would be my thinking as well. And finally, on the key takeaways, and I think this would be a question for you, Daryl. On your key takeaways page, it says that as a response to the increase in overdose deaths, funding and new resources are rapidly being offered from the province. Does that statement sufficiently reflect what was in yesterday's budget?
I'm not sure the answer to that.
Yeah, so just for clarification, Daryl, I think the programs that we've been able to assist in our way with you are programs that are pre-existing. The new budget, those programs have yet to be delineated and rolled out there for the next fiscal.
Yes, good point. So if you're referring to a budget announcement, that would be absolutely be next fiscal. Programs we've mentioned today, we have funding for, and it's already in development or operational.
Yeah, and to Councillor Paul's point that I think he was trying to make, the budget was actually last week, that we track the budget very carefully, and of course the budget only has the overarching announcement. Once the details come out, then we track it very carefully. And in fact, you know, things like the ACT teams, things like the situation table, which is a community approach, et cetera, we're not technically eligible on a per capita basis for those programs, but we've been able to work with our partners to get those programs implemented here. So, and that's really the good work of the folks that we've got here tonight, as well as Director Turner and the work that she does. So I have Councillor Vic.
Thank you, Mr. Mayor. Hi, Daryl. I don't know if this question is for you or maybe it's for Shane. At the beginning of the presentation, I believe Shane had said that our hospital is undergoing perhaps a reclassification, which could affect the Quest unit and the services it presents to the community. I don't know if I have that correct. If I have that correct, what extra services could we expect from an enhanced Quest unit in Quesnel?
So there's two areas with that. And one was when I was talking about how hospitals are designated at different levels. So currently, Quesnel is above most hospitals. It's considered an observation unit under the Mental Health Act. So Prince George is a designated hospital, and it's the only one in the Northern Interior. So what we'd be looking at is bringing Quesnel up to that same designated status, which means patients don't have to leave. Because under an observation unit, you're only allowed to stay so many days, and then you end up having to transfer out. So what ends up happening is Quesnel residents end up getting sent to Prince George rather than receiving the care local. And of course, that does a few things. It separates them from their family, being primary, but it also separates them from if they have counseling in place, you know, their GP, all that sort of thing. So, I mean, the Mental Health Act is, you know, coming from a good place, but it's missing that. You know, that's a key feature for towns. And what we're hoping to do is bring it up so that people don't have to leave. The other thing we're looking at is potentially youth beds, youth-specific beds. Because again, Prince George is the only place actually in the north that has youth-specific beds. So we have kids transferred from Terrace and everything else And as damaging as it is to transfer an adult from the community, it's even more damaging transferring a child or youth. So those are the two areas that we're really trying to focus. And again, I appreciate, Daryl's been working at this for years to get us to this point. So yeah, that's the goals.
Thank you. And I have one more question, but before I ask that, I'm remiss to say that we're very thankful for the resources that are being brought to bear to assist the community with this really troubling issue. So the second question, I guess it's for Daryl. Part of the mandate is the distribution of safer injection supplies. And I know Darryl and I have talked about this before. Is there still any thought or consideration to some kind of community support in retrieving those injection supplies that invariably end up in our community in various places?
Yeah, and I'll maybe ask Sheila about that, because this is a topic that has been in our community for years, and I understand the gravity of it. I've had some personal experiences with waltzing upon some discarded syringes and stuff, and so I get it. Sheila, I know you've been working with peer groups on syringe collection and other strategies. Any updates on that?
Yeah, absolutely. So we have worked with our peer groups for our clean team. And I know that the city has also implemented some of their own peer engagement work with picking up sharps, et cetera, in community. But the other thing we're doing is, because we've established all of these in-reach services and we have folks on the ground out connecting with people, they're distributing personal sharps containers alongside of the safe injection supplies. But because they're making more frequent contact with folks in the community, they're actually collecting up those needles as well to ensure that we're able to dispose of them appropriately. And they exchange people for their sharps containers. So some of those supplies are actually coming back at a higher rate now, simply because we're doing this in-reach service and we're meeting people in the community. So we're making contact with them, we're exchanging sharps containers. We need to make it as easy as possible for the population that we're serving. And I think that has probably led to us ending up collecting back more sharps, et cetera.
Any other council members? Seeing none. Sheila, you've spoken to it a couple of times, but how are we doing filling the various positions? Because I know we've got some positions in the community that have long-standing vacancies, so sometimes creating the teams and the programs and the positions is only the beginning of a long process. How are you doing in filling the positions that have been created?
Yeah, so we've actually had some really good success with some lovely young nurses that we've been able to fill some of our positions for the ACT and the OPS. Those were actually fairly easy to staff. But we are seeing a little bit, it's a little bit more challenging with social work positions currently. But we've had a lot of good interest. We've been interviewing, and we've actually, I think right now we have 2 unfilled positions at Westside, and otherwise we're full. So, and we are interviewing for those positions next week, and those are both with our Indigenous health team. So that's some really good success here.
Thank you. Yeah, and I think it's helpful to us to have both the nursing and the social work program in town, because we do have, a group of individuals trained in town that are from this location. So I don't see any other questions or comments. Director Turner and I, of course, had a long session with the team that you've got in front of us here. So I just want to thank all of you on behalf of council for the work that you're doing. It's very important work, and I think it's important for the community to understand how proactive this is. It may be a reaction to the circumstance, but the programs are very proactive. They are now in-reach programs, so getting out to where people are, touching people in their daily lives and trying to help them along the continuum of services that are available to them to help either stabilize them or to move them on to alternate medicines, if you will, to stabilize them. So thank you so much for all the work that you've done and for joining us tonight. It's very much appreciated.
Thank you, Mayor and Council. It's always a pleasure.
Thank you, everybody.
Thanks, everybody. Okay, Council, moving on to our agenda. Then, Executive Committee Chair Summary, Councillor Vic.
Thank you, Mr. Mayor. So this summary pertains to the executive committee meeting that we had on February the 8th. It's pretty lengthy. I wrote a bit of a novel here, so I'll just try and skim through.
Don't be a Jeff or a city manager, just saying.
So the meeting was predominantly about the Strengthening Communities grant that the city of Quesnel received last year. And as we know, Kelsey Andrachuk is the coordinator for this program. There's 3 distinct elements to the program, the first of which is the creation of the Clean Team Day Labor Program. And I can say both professionally in my work and through the work I do at the city, it has had a great impact. Certainly they're doing their job. They're doing a phenomenal job cleaning sharps and other paraphernalia throughout the community. So that work continues. Unfortunately, that program is scheduled to end in July, so I understand that they are chasing grant opportunities to continue that program after it ends. But the peer-led group has been very successful and been really great for building trust between a group which has traditionally had issues. So it's been good. Another component of the program that Kelsey is undertaking is the location of some capital amenities. The first of which they were looking into installing some outhouses to give more access for that type of service. It was deemed that they deemed that the outhouses were too much of a safety concern the way they operate, also cleanliness and sanitation. So we will not, the program will not be proceeding with the outhouses. Another capital expenditure consideration was a storage locker, where those who are experiencing homelessness can store personal effects. That idea is still on the table, has been costed out, and currently Kelsey is undertaking a suitable location for that locker and also examining safety and security concerns. And then the last capital element was the location for a potential shower laundry unit. That was not costed in the program. However, there may be an opportunity through Northern Health to obtain a mobile shower, bathroom, laundry. Again, the question would be where would it be located and how, where it would be installed that had access with city services. So again, Kelsey's working through those questions and she's going to get back to us. And then the last element of...
Just a quick correction on that. That's BC Housing, not Northern Health.
I'm sorry, BC Housing. Thank you. The last element of Kelsey's work is identifying training opportunities pertaining to education, mental health, harm reduction, cultural sensitivity training, and of course, city workers on the front line would certainly benefit from that education, but also business owners, those involved in the community that are sort of facing interactions with vulnerable persons would certainly benefit from that kind of education. So Kelsey's working through that to come up with a program to deliver those kind of educational pieces. So next we'll move on to upcoming community engagement.
Just if I could, Councillor Vic, because I think it's important for council and the public. So we are actively working to support this program at least through till the end of the year. We do have some funding in our provincial COVID grant under vulnerable population, but I believe Director Turner that the province has reinstituted this program through UBCM, and we're actively working on that too. Is that correct?
Correct. They've reinstituted another opportunity to apply for and even extend the grant opportunity, which was a great change.
Yes, I think it's important for the public and the business community to know that we're leaving no stone unturned to try and make sure this program continues.
That's great to hear. Thank you. So turning to upcoming community engagement, many will know that there's 2 new neighborhood revitalization projects currently available on our Let's Connect engagement site. First is the Davie Street Revitalization Plan, and then there's a North Fraser Drive Landing Revite Plan. So I would encourage everyone to go on to Let's Connect. It's a very easy registration, and certainly have your say on what you feel those revitalizations might look like. Turning to the Splash Park surfacing, we had a great discussion with Director Thomas on this. During our feedback regarding Laborde Park, it was identified that there's some challenges with the spray park going down in the summertime. It was explained to us that the water system at that park is not a closed system. Therefore, untreated water ends up resting on surfaces, and of course that makes it challenging to rid elements of that park of algae. Until such time that the spray park is revitalized or relocated, it doesn't make a lot of sense to invest in a closed water system. So there's really 2 solutions. The best one lies in a maintenance plan, which Director Thomas has committed to looking at. So what it might look like is more often, more frequent cleanings with specific targeted areas of the park versus a less frequent, really thorough cleaning only every 2 weeks. So the thought is that if we're able to get at that more often and earlier, he also mentioned it might be possible to get at it earlier in the day to prevent closures of the park. So with those 2 concepts, we hope to see better results in the coming summer months. And then in concert with the cleaning routine, better signage and community notification will be utilized, so at least the community knows when the park is going to be down for some cleaning. The spray park. Next, we discussed the Laborde Park Capital Plan. Director Coben led that conversation. We covered off several aspects of the capital plan for Laborde Park. During, again, the recent engagement process, the lack of shade was raised as a concern for parts of Laborde, specifically the kids' playground and even the spray park. Options for a shading system to cover the entire parts of the park, like the playground, are very expensive and would require removal in the fall and setup in the spring, so it's quite labor intensive. A more focused approach that we suggested is to consider shade options that cover just the sitting areas. And then these options, Director Coben took that back, and we're going to cost that out and bring that back for future consideration. And then we also heard about the scope of the Friendship Stage renewal, and we agreed that the rear of the museum, which abuts the Friendship Stage, should also be looked at and included in any renewal project for that stage. This part of the museum, as we know, includes the washrooms, and I believe they haven't been looked at since the 80s, so they're in dire need of some renewal. Renovation, and it makes sense to incorporate this part of the building with the refresh of the stage. Feedback regarding the stage itself suggested making sound and video more plug and play, easy to use, and consideration for security solutions for when we do add those new elements. But we do have to be mindful of security considerations so that these technologies are protected. Director Coben will engage with a consultant and bring back a thorough plan for executive to review. And at this time, there are no recommendations, and our next meeting is March 16th. Thank you.
Okay, any questions or comments for Councillor Vic on the report? Seeing none, thank you, Councillor Vic. We'll move on to the staff reports then. So the first staff reports on the Façade Improvement Grant Program. Director Turner.
I'm actually throwing this over to Lyndon Hunter, our planning technician.
All right. Thank you,
The floor is yours.
Perfect. So the purpose of this report is to summarize the facade improvement projects completed and the financial rebates provided under the facade improvement program for 2021, and then officially announce the 2022 program. To summarize, for 2021, all $20,000 of the funding that was allocated to us was allocated to 5 businesses. However, 3 projects were not completed for various reasons, so we only had 2 projects complete. The City of Quesnel provided $7,812.20 of funding to 2 businesses under this program. The past 2 years of the program has seen a decline in completed projects and funds awarded, likely in part due to the impacts of COVID-19 on local businesses and contractor shortages. I want to make clear that it's not that we aren't receiving as many applications. It's more that we're not completing the projects. So we receive many applications and we allocate all those funds, but not all the projects follow through and are completed. So the city has received approval from NDIT for a $20,000 facade improvement grant program for 2022, and we're currently accepting applications. So 2 projects were successfully completed in the 2021 program. First is Long Table Grocery in West Quesnel. So for that project, painting and installation of a new mural on the eastern-facing facade was completed, and the mural is made up of 7 hexagonal frames depicting aspects of nature seen in the Cariboo region. Second was Ashley Furniture in South Quesnel. That project saw the repainting of the facade, the building facade, and installation of some new affixed signage, and that was all as per Ashley Furniture design guidelines. The project also included a refresh of the store's pylon sign on near the highway, but this was not eligible to receive funding as it wasn't affixed to the building. So before and after photos for both of these projects are attached to the report as well to review the changes that were made. As for the 2022 program, as mentioned earlier, the city has received approval from NDIT for another $20,000 program, and we're currently accepting applications until the May 31st deadline. To go along with that, we do have some marketing underway, including social media ads, updates on our website, and information has been sent out to the BIAs, Community Futures, and Chamber of Commerce. And then lastly, the marketing poster is also attached to this report and can also be found on our website. So since this report is for information only, there is no recommendation to council.
Great, thank you. Questions or comments? Councillor Rudenberg.
Thank you. So the money that we did not end up spending, does that get turned over? Like, does it accumulate on top of the new 20,000, or it's just now 20,000?
It is just 20,000. So how it works is we actually pay the businesses up front with our account, and then we get reimbursed from NDIT.
Okay, thank you for that clarification.
Okay, any other questions or comments? Seeing none, thank you very much for the report. We'll move on to the next staff report, and that's our Chief Building Official. Kevin's going to go through the step code and some recommendations to council here.
Thank you, Mayor and Council. The purpose of this is to provide information on the upcoming mandated by the province to adopt Step Code 3 in BC Building Code by the end of December 2022, and to recommend a path forward for promoting and encouraging construction levels at a higher level than mandated steps. The following report was presented to the Policy and Bylaw Committee on February 17th. The BC Energy Step Code is the product of a multi-year collaboration between the province, industry stakeholders, utilities, and local governments. Adopted by the province in April 2017, the Energy Step Code allows BC local governments to voluntarily reference a series of progressively more stringent energy performance steps in regulation. The first mandate by the province is the adoption of Step 3 requirements into the code by the end of December 2022. The province has requested municipalities inform when they begin consultation and any plans to regulate or incentive the step code. Staff are recommending an education and awareness plan for the upcoming mandate with a focus on working within industry partners to move to a higher step beyond 3 prior to being mandated. The recommendation that council directs staff to roll out the education and information necessary to allow the industry to succeed in the upcoming mandate Step Code 3 requirements. Inform the province that the city has initiated education and consultation. Work on identifying opportunities to incentive moving towards higher steps prior to the province mandates. And I'll take any questions.
Great, thank you. And just for reference for council, the Policy and Bylaw Committee had a pretty substantive go at this in detail and suggested that the report just be brought directly to council at this time for council's edification. Questions or comments? Councillor Vic.
I'm not sure if I should just move the recommendation to get it on the floor to discuss, or maybe offer some constructive criticism before I do that. I'm not sure how that.
Well, if you're going to criticize the motion, I would suggest that you don't put it on the floor first. You try and refine it first.
Let's do a little refining, maybe. We'll see how that goes. So, first of all, thank you for that. Thank you. I think there's certainly no opposition to try and build more efficient homes to lower costs for homeowners and whatnot. From the recommendations, there's 3 recommendations. I would suggest, or I would float the idea of maybe standing down the parts that ask builders to move towards higher steps. And the reason I make that suggestion is I'm not sure how many builders are even doing step 1 today. Lots. Okay. Well, that's good to hear. I'm happy to hear that. So of course, step 1 would be blower door tests and consulting with an energy advisor.
So if I could just clarify, what step are we currently at and builders required to meet at this point? Yeah, no, I know.
So right now we're at 0. We're not requiring anything. We currently have one contractor that is building to step in this area, but that's it.
Okay, and just again for clarification, the step 3 requirements come into effect province-wide, is that correct, at the end of this year?
Correct.
Okay, so that's where the gap is that needs to be broached?
I understand, yeah. So we have a lot of work to do inside of 11 months here to get builders to get ready for next year, essentially, right? So
hang on, Director Turner's trying to jump in.
I think I'm just hoping that you're understanding the report. So basically, this report is all about talking about education and communication to get the builders ready. It's nothing about regulating them further, and it's not even suggesting that we will ever regulate further than the province, although we want to try and improve, talk about incentivizing, talk about that going forward as we get a better conversation going on with the builders.
Thank you, Director. I do understand that. So I'll continue with my thought. If we put our horsepower in just making sure we have all of our builders on board with step 1 through 3, I think that's a pretty monumental task on its own, rather than trying to bring builders who aren't on step 1 or 2, let alone 3, getting them to think about step 3 and above. So that's my thinking.
Yeah, and again, the reason I keep jumping in is because we went round and round on the very same thing. So the recommendation is simply to work on identifying opportunities that moving from step 3 beyond, not to regulate step 3 and beyond, because you will have individuals that once they get to step 3, the quantum leap is to step 3. Post step 3, it's different kinds of materials, sourcing, et cetera. So the feeling is if we're going to have a lot of housing stock built over the next 3 to 5 years, then if we can find ways to move people once they're at step 3 to higher steps, then let's look at those opportunities, which is all this is saying. What are some of the tools and opportunities we have to get them to consider just moving right up the code, right? not regulating them to do that, but figuring out ways. So as an example, one of the substantive discussions we had was, do we want to take a look at what's necessary in terms of the expertise that needs to be available? So the energy advisors, the energy planners, that's going to be a pretty significant pinch point in these builders achieving step 3 and then going anywhere beyond it. They're not currently available, et cetera. And a lot of us lived through this when they changed the septic regulations, where people couldn't build septic systems because there were no registered septic installers, septic planners, septic inspectors, et cetera. So that's just one of the conversations we had that staff are going to go away and look at and say, okay, what would it take for us to have the energy advisor expertise made available? Do we need to work with the college? Can we advance the programs? That's really all it is how do we keep moving down the continuum? Kevin?
And then I'd just like to add that going from a step 3 to a step 4 is not a huge jump. It's really not. It's more in education, educating the builders on proper procedures on the construction. And if we can incentivize that, I can't see why we wouldn't.
Okay. Director Turner?
Thank you. And just to reiterate, so right now it's all about us getting to the table, talking with our contractors, talking with our development community, making sure that they are aware, because we are being told there's a lot of gaps in awareness about what's coming and the education opportunities available. So we're just being the conduit to make sure our contractors are getting the education for the type of construction that they are going to have to do in December, and making sure all of the gaps are filled in. One of the things I do really want to point us to is in this report on which page is it? The page 5 of 6. It talks about we are partnering already with the Community Energy Association. They are putting on a workshop. They're going to be coming with a workshop. That workshop is being scheduled for April 13th. About we will put out. We're putting that out for a save the date right now. We're working with our building clerk, who's going to get that information out. We are going to start putting out information, education opportunities with Kevin and his team.
No, I mean, pursue it. That's the reason it's here, and we have a light agenda. So, okay, go ahead. Councillor Runge.
Yeah, I think, and we spoke about this at PEPCOM also, I think it's when you read this, like promoting and encouraging constructions at higher levels than mandated steps, that raises, I believe, a few red flags in the construction industry right now when they see that. And also I would love to suggest a slight change to number 3, which I don't think changes our intent, but make it to work on identifying opportunities to incentivize and support moving forward in the step code process. So that, I think, covers what we're still trying to say. Because we have 2 different step codes here, like we have 2 levels, one goes to level 5 and one that goes to level 4 with this net zero ready with the wood frame housing there. I think it's on page 4 of 6. And on page 3 of 6, step 4 is just 50%, or 40%. So we have different percentages, more efficient when we're looking at it.
Yeah,
go ahead, Kevin.
The difference is Part 9 buildings and Part 3 buildings.
So maybe I need some clarification on those buildings, because the fear that I have is that, and I said this, I think, at the meeting too, I don't want to scare people from getting there. With understanding the intent that we want to be on the forefront, we want to have greener houses, and we want to have more efficient houses. And that's why I believe just making that recommendation a little softer while still getting...
You actually strengthened the regulation and made it sound much more regulatory than what it currently is, because these individuals will have no choice. Step 3 is going to be step 3. We have no choice. And these individuals will also have to meet whatever the provincial guidelines and requirements are beyond step 3. So the way that you're framing it, you're suggesting that somehow we're going to meter what is a provincial responsibility. All we're saying is, if you can get somebody to step 3, and we have a way of incentivizing them to say, you're already there, why don't you just do what you need to do to start going to step 4? Then you're just putting them in a better position relative to the regulatory scene that's coming at them, and you're putting us in a better position relative to what the increasing demand is for housing. So on the demand side, you're going to get more demand for closer to net zero housing, higher efficiency housing, et cetera. And one of the things that we have said as a council that we want to get into affordable housing, well, one of the arguments I have with the province on affordable housing is the most affordable housing is the most energy efficient, because your long-term costs of housing are in the energy requirements for it, whether they're built in your downtown core so people can walk. If you can negate transportation and negate energy, you free up cash on a continuous basis for individuals. That makes housing affordable. All we're saying in here is step 3 is mandatory. We're going to work with the community to get them to be prepared and ready and capable. In that process, we're going to look at where the pinch points might be. So trying to figure out how to address those pinch points. And we had quite a substantive conversation about, do we even have to look at contracting our own energy advisors and making them available to the community? So that's the kind of feedback we need from staff as to what does incentivizing look like. But we're not saying in any way, shape, or form that we're going to tell people that they have to go above step 3 any sooner than the province. But if they're at step 3, why not go to step 4? That's all we're saying. And how can we help you get there?
And I would say that the education opportunities are the real key there. That's going to be educating them on what is going to take them to step 3, then the start, that education build up. And we had a very astute councillor that said, and by the way, you should also be educating the community in general on this stuff. So we're working on that, getting that information out, and that will be put to council, because I think there's a lot of education for everybody on what this really means and what we need to do to get prepared.
Go ahead, Councillor Rudenberg.
Thank you. The other piece is, I mean, we look at this 2032, it's like, oh, that's so far in the future. No, it's only 10 years away. So when the province is saying they'd like to see us at, net zero ready by 2032, that's not that far away. I know that in the north, we do have challenges to think that we might get to that final step, whether it's 4 or 5, but within 10 years, there are opportunities for creative building supplies, et cetera, that will help us get there. The other piece is, I truly believe the province really knows how important this is, and they are providing different incentives now through their budgets to look at how you can retrofit your homes, et cetera, to make them fit into these step code levels. So I think, the education piece is really important. And as, our staff have said, the difference between 3 and 4 really isn't that big of a leap for contractors or builders. It's the next one that's going to be the harder one. But if we can get them to understand that, if you can build a step 4 house, I think people in our community are looking for this. I think they're looking for ways to be part of the solution when it comes to our climate. So I think this is a good step for Quesnel to take.
Councillor Paul.
Yeah, thank you, Mr. Mayor. A question to staff. I know that we no longer have a Quesnel Construction Association per se, but does staff have a pretty good handle on building contractors that are out there that would need to be consulted with? And I do have another question.
And I want to be crystal clear, we are not going to be consulting with anybody. This is not our thing. This is provincial regulations. What we are simply saying is we're going to start educating the contract community about what's coming at them.
Well, just I need clarification then, because number 2 of the recommendation, inform the province that the city has initiated education and consultation. What does that mean?
But the way that you framed it is that we're going to be going out consulting with that group. So yes, we are going to be in a consultative manner, but the key is education, right? I just didn't want the public to think that we have anything to do with the implementation of step code. We do not. It's mandated by the province. So there's not it's not a formal consultation the way we would think about it, is are you ready for this? Do you want to do it? All of that stuff, right?
So
it's consulting
therefore,
in the sense of making sure they're aware.
Whose responsibility is it to communicate with the contractor, the province or
It's actually the
city?
contractor's responsibility to know what the building code is.
Okay.
Okay. Director Turner.
Thank you. Just one point of clarification that might sue this up. This is language that comes from the province that we are supposed to inform them when we're educating and consulting with the construction community. And part of the reason why consultation is in there is because we have the ability to go higher. And so they want us to consult. We've had lots of conversations. We feel like the construction community is not ready for us to go higher, which is why we recommended not doing that, but getting the education going. So we'll be consulting that, yes, we're not going any further, we're coming with you, but you need to come on the bus with us and get educated. That's basically what the consultation is going to be.
Yeah, and one of the reasons I think that council has to be hypersensitive to this is that one of the biggest issues that I deal with in complaints about development services and, them getting to know is that developers and contractors don't understand that the building code isn't ours, that they're building code requirements or engineering requirements. So we are not consulting with respect in the formal sense, right? We're going to be going out and educating. Go ahead, Councillor Paul.
Okay, and my second question, and I'm presuming that this is for new construction and substantial renovations/additions only, and it's only residential? It doesn't apply to commercial and industrial?
Correct, at this time, yes.
Okay. If you take a look at the Energy Advisor training website, though, they are trained in residential renovations. And one of the conversations we had at PABCOM, and it relates to educating the general public about this process, is that why wouldn't you, if you're going to be doing a substantive renovation, which we're seeing throughout the community, or you're adding a secondary suite, or you're adding a laneway house, et cetera, why wouldn't you look at it through that lens of that energy retrofit? And I know lots of people are already doing that on their own. So that would be potentially part of our education process. And the Energy Advisor program and Energy Planner program actually includes training for those individuals on renovations, not just on new builds. Okay, Councillor Runge.
I'd just like to go back, I think, to the consultation portion, because I do believe we do, and it's not a consultation with regard to them giving us ideas, but I'd really feel, I think we should listen to our construction community and see where are their shortcomings so that we can support them going forward. We have the letter from Mr. Hart in the back, and are we able to use his and possibly other expertise to just say, here, you could help us with an energy advisor or with this, and that's the type of consultation I was thinking of, not understanding that we're not making the rules here.
That's exactly the point. That's what we're doing.
Other questions or comments on this? Councillor Vic.
Yeah, so I understand everything that's being said. I do. So it's clear that we have some major gaps between getting our builders through steps 1 through 3. There's major gaps, right? Is that correct?
Yes.
Okay. So understanding that we have major gaps even to get to step 3, which is going to be the law of the land as of December, I really feel that that should be our primary focus and not distract the issue by inviting builders to entertain going beyond.
I think, again, Councillor Vic, you're completely misunderstanding the intention. So why wouldn't we, when we've got all of the builders in the room, ask them questions about what would it take for you to consider if you're forced to go to step 3 and step 4 is not a big jump, why wouldn't we? Because all this is saying is work on identifying opportunities. So just asking those builders, what kinds of things would it take for you to consider? That's all. instead of, let's get you to step 3, et cetera. Now we're going to come back and we're going to go at you for step 4, right? So I think you're reading too much into what's going on. This is not regulation. This is just simply saying, in the moment, can we get some advice on how we continue to move up this continuum? It's coming at you anyway. Director Turner.
Thank you, and that is, Councillor Vic, what you're saying is exactly what we're doing. We are focusing on getting people to step 3 and focusing on getting them educated on just the step code coming until that point. But I can guarantee we'll be working with our industry partners on that, who are going to be educating on the whole parameter of step code, which in itself will have the ability to educate people about maybe going higher if they want to. Definitely the focus is just on educating about step code and getting to step 3 at this point. But definitely we didn't expect to come back on January 1st and get a new resolution. What we're saying, this goes beyond a yearly basis discussion. This is now saying, and then once we're there, going, to that next level about really getting them educated going further.
I'm good.
Okay, and the word shouldn't be incentive, it's incentivize. And Councillor Runge, you wanted to insert on identifying opportunities to incentivize and support, or does it matter?
It really doesn't matter, but we should definitely change it to incentivize.
Okay. And again, I think with the understanding that there's no intention of regulating at all here, it's just understanding from the contracting community what would help them. That's all that statement is about, right? So with that in mind, can I have a mover for the recommendation? Councillor Rudenberg, seconder for the recommendation, Councillor Goulet. Any further questions or comments? Councillor Paul.
Thank you. Does this include the third bullet of that recommendation?
Yes, it does, as explained.
Okay.
Okay. Councillor Runge.
Actually, as I reread that, my apologies, that last portion prior to the province's mandates, I would just remove if as a friendly amendment to that. I think we're saying everything there without adding that in there. We're just working on identifying opportunities to incentivize moving forward.
Yeah. Again, it doesn't change the intent. If you get somebody who's an early adopter, you're going to help them to be an early adopter. Okay. So work on identifying opportunities to incentivize moving higher up the step code.
Again, I just should say that there are contractors going higher than this now.
Yeah. Okay. All right. So removing the prior to province mandate. And the mover and seconders are good with that? Nuance? Okay. So on the recommendation, all in favor? Any opposed? Carried. Thank you. Next up, we move to correspondence. And so, Ms. Hartley, the letter from Canadian Mental Health Association.
We received an email from Stephanie Aisley of the Canadian Mental Health Association on February 15th. The clinical health program at the Quesnel CMHA office will run out at the end. Funding for that will run out at the end of August 2022. Since opening the office, we have worked with over 100 people providing multiple accessibility for free services. Our goal is to meet people where they're at. They're requesting that we write a letter as to why our community needs the program to continue. It would be greatly appreciated, and any information regarding funding opportunities would also be greatly appreciated.
Thank you. So can I have a motion to provide a letter of support? Councillor Runge, Councillor Rudenberg. Any further questions or comments? And Ms. Hartley, I think the importance of this program is such that we should write a letter, but if you can get Ms. Long to set up a call for me with them as well, so that I can have that conversation directly with them, and then we'll get the letter off to them as well, okay? So on that, all in favor? Any opposed? Carried. Okay, next one, the BC Farmers Markets.
February 9th, 2022, a letter from the BC Farmers Markets. The BC Association of Farmers Markets worked diligently with the province of BC's Ministry of Health to deliver for the 10th year the BC Farmers Market Nutrition Coupon Program. In Quesnel, residents redeemed $14,544 with local farmers at the market, and we are proudly partnered with North Cariboo Aboriginal Family Program Society Community Kitchen. The request is that we ask us to send, they ask us to send a letter to the Minister of Health encouraging the funding to continue for the program.
Okay. Councillor Runge, so moved. Councillor Goulet, second. Any further questions or comments? All those in favor? Any opposed? Carried. Okay. No changes to upcoming meetings, no changes to committee appointments, announcements of future events. Councillor Rudenberg.
Yes, thank you. So this is actually just a bit of a follow-up to the comments that you started our meeting with today in regards to what is happening in Ukraine. And if Council will allow me to indulge here, having spoke with Amy Quarry, one of our community partners, let's just say, she's getting something going here, and I'd like to read a bit of her email that explains the program. So, hello, partners. Like many people right now, my heart is so heavy witnessing the stories from Ukraine. Like I often do when facing many of these big world challenges, I find myself feeling overwhelmed and unsure of what to do. So while there are many conflicts in the world driving people from their homes and many significant challenges here in Canada that all need our support on an ongoing basis, this situation is calling my heart to action in this particular moment. We may not be able to do much more than send money, but I know from projects that I have undertaken in the past, so like Soup for Syria, that doing something is always better than doing nothing. So I know as well on a local level that the general mood among many business owners is that they are struggling, and anything that we can do to rally and show love for them will only help us feel more connected to our home community and to each other, something that I think is important, especially in the face of these huge global events. So your participation in this particular event will both support and shout out local businesses during these challenging times, as well as support critical and timely humanitarian work in Ukraine, and even give you a chance to win hundreds of dollars in gift certificates for supporting an important cause. So to enter the Love Local draw, what she's asking our community to do is to make a donation to a Ukrainian aid organization between March 1st through to the 12th of 2022, and send a photo of the donation receipt to longtablelocal@gmail.com as your entry to our draw for Love Local prize packs. Each $20 donation increment counts as one draw entry. The larger your donation, the more chances you have to win. Other ways to help, if you'd like to personally contribute to the Love Local prize packs and support our local businesses, you can donate or purchase a gift certificate in any denomination from a local business in Quesnel and drop it off to us before March 12th. These gift certificates will be part of the prize packs that people can enter to win by making a donation. So spread the word, shout out to your favorite local businesses, and encourage your friends to participate by sharing this event widely. Watch for the announcement of the winners and the total funds donated on March 13th, 2022. She has a list of various organizations that you could possibly donate to, but you can check those out on her social media page. For transparency and clarity, understand that Long Table Grocery is the organizer of this fundraiser, but is not collecting any financial donations directly. Long Table will organize the collection of the gift certificates and entries to the draw, and will draw and announce the winners on March 13th. Winners will be announced on the Long Table Grocery social media channels and contacted directly. Prize winners must pick up their prize in person at Long Table, provide ID. So if you have any questions, please give Amy Quarry a call at 250-983-5675. Thank you.
Thank you, Councillor Rudenberg. Any other announcements? Because I was in error, bypassed the bylaws, so we're going to have to go back and do that. Okay. All right, so thank you for that. So going back to bylaws, again, my apologies. Bylaw 1981, City of Quesnel General Local Government Election Bylaw, final adoption. Councillor Paul so moved, Councillor Goulet second. Any further questions or comments on this bylaw? Seeing none, all in favor? Any opposed? Carried. And bylaw 1919, City of Quesnel mail ballot authorization, procedure bylaw, final adoption. Councillor Goulet so moved, Councillor Vic second. Any questions or comments? Seeing none, all in favor? Any opposed? Carried. Okay, and then any gallery questions? RJ, it's nice to see you back in the very back. Okay, any gallery questions? Seeing none, I would invite a motion to adjourn. Councillor Runge, Councillor Rudenberg, all in favor? Any opposed? Carried. Thank you, staff.